All right, welcome back to ABA Exam Review and the continuation of our BCBA practice question series where we're going through another set of questions together and breaking them down. If you're new to the channel, welcome. If you're returning, welcome back. Please like and subscribe. Check out behavioranalyst.study.com for all of our study materials, including our combo pack. When you pass your exam, let us know so we can include you in the Sunday shout out. Work hard, study hard. Let's get going. George collects baseline data on aggressive behavior for 10 sessions, showing a stable pattern averaging 12 instances per session. George then implements an intervention and aggression immediately drops to an average of 2 instances per session across 15 sessions. To strengthen the demonstration of experimental control, George withdraws the intervention and aggression returns to 11 instances per session. What element of baseline logic is being demonstrated when the behavior returns to baseline levels? All right, pretty long question, some numbers. But if we attack it like we are taught to and how we should, it doesn't become all that difficult. When we think about baseline logic, what do we think of? We're thinking about prediction, verification, and replication. So if we look at our answer choices, obviously, control is out. So we're looking for verification, prediction, or replication because we are looking for baseline logic. And the best way to understand baseline logic is a simple ABA design, okay? Baseline, intervention, baseline. Now, if we start in baseline, right, where we have a baseline for 10 sessions showing stable, about 12 instances, okay? This is our baseline. What is our prediction? When we make a prediction, we're predicting that baseline would remain the same if intervention is not implemented. When George does implement an intervention, it drops to about 2 instances per session. Now, what is our verification in this case? Verification will be the reversal when we can verify that our prediction was correct. So if we reverse it or withdraw the intervention and we go back to baseline and our prediction, this piece is verified, that's going to be verification. So we go back to about 11 instances per session. And so our prediction was about right. Had intervention not been introduced, the behavior would have stayed relatively the same. So what is being demonstrated when the behavior returns to baseline levels? Verification of our prediction. Replication, of course, is taking that intervention and doing it over and over again and trying to replicate the outcome. A teacher implements an interdependent group contingency where the entire class earns extra recess if the class average for completed homework assignment reaches 90%. After 3 weeks, most students are completing homework, but 2 students consistently fail to complete assignments, preventing the class from earning the reward. Several students begin verbally criticizing these 2 students. What should the behavior analyst recommend? So group contingencies are very strong, and an interdependent one says that everybody in the group must complete this contingency so the whole group will earn the reward. In this case, the entire average must be 90%. The problem is with the interdependent group contingency, a few quote-unquote bad apples spoils the bunch, as the saying goes. And in this case, 2 of these students are ruining it for everyone else. And now it's causing social issues, which is a known problem with some group contingencies. Now, as the behavior analyst, what would you recommend given the information we have available? A, switch to an independent group contingency. It's a possible solution, right, where everybody is responsible for their own outcome and their own reward. B, continue the intervention since peer pressure may motivate the 2 students. Well, clearly it's not motivating the 2 students. They are still failing, and now the social pressure is starting to get to the 2 students. So B doesn't seem all that feasible. C, remove the 2 students from the contingency. The rest of the class can earn rewards. Well, that eliminates the point of the interdependent group contingency where everybody's involved in earning that reward. D, add a punishment component for students who don't complete homework. Also an option. So A and D are both options. Why would we pick A? Well, we don't want to jump to punishment if we have other solutions available first. So before we try punishment, maybe we give everybody the opportunity to earn their own reward. So even if these 2 students aren't doing what they're supposed to do, everyone else can still earn that contingency. Then if that doesn't work, then maybe we move to something a little more drastic like punishment. Tom supervises 3 technicians who each work with 4 to 5 clients. Tom delegates discrete trial teaching implementation to the technicians after providing training. One BT consistently implements procedures with high fidelity, while another shows variable fidelity. What level of oversight is most appropriate for each technician? So we have a supervision question here. And supervision and training is very similar to client work, right? We're trying to establish functions and what motivates our technicians, behavior plans. And if you have 2 clients, for example, and one is struggling quite a bit and one is doing well, then naturally, who are you going to likely spend a little more time with? The one who is struggling. And so with technicians, each one must be treated individually, and we must approach them based on their needs. So if we have technicians who are working with 4 to 5 clients, and we have technicians, one who is showing high fidelity, which means they're implementing things correctly, and another is kind of showing variable fidelity, which means sometimes they're good, sometimes they're not as good. What's going to be the most appropriate oversight for both of these technicians? A, Tom should maintain equal supervision for each technician to ensure consistent quality. Well, not necessarily, right? One technician at this time is showing a little more struggle, and they might need a little extra supervision at this moment. That might change in the future. We're going moment to moment and being organic. B, Tom should reduce supervision for the high fidelity BT to minimal contact only. Not necessarily, right? You still want to supervise strong BTs, so we don't want to just minimally contact them, but we might have to do C. We might have to provide more contact to the low fidelity BT compared or relative to the high fidelity BT, who might not need as much oversight. D, Tom should remove the low fidelity BT from service until they improve. No, it's our job as the BCBA to get them to improve in practice. So what this is showing is, just like with clients, you need to be flexible and organic and always adjusting to the needs of your technicians. Okay, treat technicians like you would a client. You want to provide the best service, best training possible to them, and in turn, they're going to give the best services to our clients and kind of produce the best outcomes from there. A behavior analyst needs to measure stereotypic behaviors that include hand flapping, body rocking, and vocal stereotypy. These behaviors occur at high rates, often overlap, and vary in duration. The analyst needs a practical measurement system for busy classroom staff. Which approach would best balance accuracy with feasibility? We're trying here to do what? We want accurate data, right, to make good decisions, but it also has to be feasible. And if we have an analyst who is measuring hand flapping, body rocking, and vocal stereotypy at high rates, we have a situation with several topographies of behavior that are occurring really often and overlapping, and then have varying durations. That's going to be a very challenging response class to measure, right? All these topographies happening all at once at a high rate. So we have an issue where the classroom staff is busy. So all these things come into play, right? So how can we make this feasible for this classroom staff and still try to get somewhat accurate data? A, continuous frequency recording of each topography separately. Now, what is the true feasibility of something like that? Well, very low. How can we continuously record all 3 topographies happening by counting them if they're occurring on top of each other at high rates? It's going to be nearly impossible, right? B, partial interval recording with 10-second intervals. Definitely a possibility, right? We can just see if the behavior occurs, whether the behavior occurs or not, okay? And this question came up the other day. Well, what's the difference between partial and momentary time sampling, right? Because momentary time sampling, we're only looking at the end of the interval, so we don't have to observe the whole time. Partial interval, if the behavior happens, you won't have to observe the whole time, but if it doesn't, you will. Well, if the behavior is happening at high rates, that means there's a good chance it'll happen within that interval, and you'll be done with that interval. So that's why partial interval is good here and better than momentary time sampling, because 2-minute intervals at high rates is not going to yield very sensitive data, because that behavior is going to be happening quite a bit, and we're only getting 1 data point every 2 minutes. It's not going to be enough. C, duration is the same as continuous, right? And we already discussed why that's not feasible. Best answer here is partial interval because it does happen at a high rate, and the interval is much shorter than 2 minutes, so we're going to get a lot more data compared to every 2 minutes. A behavior analyst measures a client's on-task behavior once during baseline and once after intervention, showing an increase from 40% to 75%. A colleague questions whether this demonstrates a functional relation. What is the primary limitation of this design related to single-case experimental design principles? So we just did a video on the limitations of single-case experimental design in our task list series. Be sure to check that out. And here we are looking at a limitation based on single-subject design. What do we know? We know the analyst measured the behavior once during baseline and once after intervention. Now, is that ever okay during single subject, right? No, like let's think about our ABA design. Based on this data, we have one data point here, one data point here. Is that enough to demonstrate a functional relation? Not nearly. So what limitations does this show? A, this design lacks a control group for comparison. Well, in single case experimental design, we don't have a control group, right? Because the individual is their own control. B, the design lacks repeated measures. Yes. One data point, not nearly enough. Single case design is all about repeating the measurement over and over. C, the intervention was not implemented long enough. Well, we don't know how long the intervention was implemented because we don't have any data. D, the behavior should have been measured using frequency rather than percentage. Again, we're not measuring percentage, and regardless, it doesn't matter because we only have 2 data points for the entire intervention. Not nearly enough, lacking repeated measures, which is a primary characteristic of the single case experimental design. Thanks for watching. Check out behavioranalyststudy.com for all of our study materials. When you pass, let us know so we can include you in the Sunday shout out. Work hard, study hard. See you soon.